Hello to the Bill and Melinda Gates Foundation. My name is Molly Horgan. I am a public health educator, and today I'm presenting to you a proposal to address the childhood hunger issue in Venezuela currently. First off, our problem statement. The children of Venezuela are facing severe malnutrition and hunger due to a lack of access to food resources, as well as the economic crisis currently facing their government. So some public health statistics. The child mortality rate has increased by 100% in recent years. And as well, the maternal mortality rate has also increased by 30%. In the year 2016, over 11,000 children under the age of 1 died in Venezuela due to this crisis. Unfortunately, this crisis is due to many different social determinants of health, which are predetermined. The economic crisis began in 2012, and since that time, the inflation rates have increased by 4,000%. Other important determinants of health include the poor overall healthcare access of the entire country, the very limited food resource centers across the country, and lower socioeconomic status of persons in general due to the inflation rates. With the geographic limitations, people in rural areas of Venezuela are oftentimes seeing this problem more severely. However, urban people are also seeing this problem. So it is not just based on urban versus rural living. It is a countrywide problem. So using the socio-ecological model, we are going to describe this issue at the individual, interpersonal, organizational, community, and policy level. At the individual level, people's attitude about food insecurity and food security is hindering this issue. We need to educate parents about the importance of childhood nutrition and where to access food. However, the negative attitude towards the Venezuelan government is hindering the resources available and is hindering the usage of the resources that are available, although they are limited. At the interpersonal level, we need to promote positive social networks among people. So associating people with dietitians, with nutritionists, with farmers, with local markets, building networks that help build healthy children. And we need to avoid the negative social networks, the ones that have zero access to healthy food. At the organizational level, we can help promote and build local food distribution centers, much like food pantries or community gardens. We can also introduce social services. Right now, there are not very many social services in Venezuela that are helping address this issue, and that is causing this problem. At the community level, we need to get businesses involved. There is a severe lack of financial resources that are helping address this issue, and local companies in Venezuela can help do that. And again, at the community level, there are very few coalitions or task forces that are trying to actually address this issue, so we need to step in. At the policy level, we need to, introduce policy that helps children gain access to nutrients and supplements instead of just relying on fruits and vegetables. However, the government agencies and their lack of financial resources are hindering this proposal. For my proposal, I would like to combine 3 different evidence-based practices that have worked here in the United States and translate them into a Venezuelan program. So first, we would introduce school fruit and vegetable gardens where the school-aged children would actually grow the fruits and harvest the fruits and vegetables so that they learn about how to eat healthy and where their food comes from. And this kind of plays off of the second proposed intervention, which is early agricultural and food security education. Across the country, we need to introduce different curriculum for these children so that in their future, they will understand the importance of food security and healthy eating. And finally, we can introduce a social service or food stamp program, basically a social benefits program, much like the one we have here in the United States, the SSI program, in Venezuela. Now, this takes a lot of financial resources, so that's where we come in. In order to translate this into a Venezuelan community, we need to combine all three of these interventions into one. So we will build these fruit and vegetable gardens in the school system. We will teach the children how to grow that fruit and vegetables and how to harvest everything. And then we will provide education that coincides with this garden program. And finally, we will supplement the program with social service benefits for families that will only get their fresh fruits and vegetables from these school gardens. That way it is a full circle program. And hopefully, with your help, we can help end child malnutrition and hunger in Venezuela. In order to evaluate this program, just like any other public health program, we have to measure the process, the impact, and the outcome. My evaluation is based on the overall fruit and vegetable consumption of the Venezuelan community. It'll also be based on people's attitudes towards food insecurity and food policy in Venezuela. So we will conduct surveys of the persons utilizing these school fruit and vegetable gardens. We will also measure the success based on how many people qualify for this social service benefit program. And we will further evaluate the success based on how many people actually use their social service benefits to buy healthy food. The overall measurement of success is the childhood hunger and malnutrition rate. So the hospitals in Venezuela are seeing increased cases of childhood malnutrition because of this crisis. We can evaluate the overall success of our program based on how many cases the hospitals are seeing now of childhood malnutrition. However, with any public health program, there are great challenges that pose to us. Primarily, we need a lot of cooperation among the participants. This means community members, teachers, policy writers, statisticians. Everywhere from top to bottom, this program needs cooperation among everyone. We are also financially limited. Venezuela itself is facing an economic crisis due to inflation prices, so they have no financial resources to help with this program. It will all be outside sources. We also need to help the community with their overall attitude towards healthy eating. We need to implement this education and help parents and children understand the importance of healthy eating. So, as I said, we will continually educate everyone from top to bottom throughout the program, holding public health forums, holding town meetings, whatever it takes to continually educate the Venezuelan community about this program. As I mentioned, we need to reach out to different financial sources, not just from Venezuela and not just from the Bill and Melinda Gates Foundation. We will need global help. This is a public health crisis on a global scale. And finally, another solution, we will continuously improve this program through our evaluation. We will make sure that everything is working properly, and if something is not working, we will change it and we will improve it. And this is going to take much collaboration between the government, between public health officials, between students and teachers in the schools, between social service projects and programs in Venezuela, as well as parents and families that are affected by this crisis. So here is my logic model for this evaluation program. Basically, we will build the gardens, we will teach the children how to use the gardens, and then we will provide families with ways to purchase food from these gardens. And hopefully, at the end of it, we will be able to reduce the childhood hunger in Venezuela. Thank you very much for your time, Bill and Melinda Gates Foundation. I appreciate this opportunity to present this proposal to you. Should you have any further questions, please do not hesitate to ask. Thank you.